Okay, we're going to start in week 2, abnormal psychology. And here we're going to be looking at, in part 1, we're just going to look at assessment. So the first part of anything when it comes to diagnoses has to begin with an assessment. And so there's different methods by which you gather information about the individual and how you do it. And so what we're going to look at first will be the different methods of gathering that information, so the different techniques that are used to gather the information for assessment. And then part 2, when I make that video there, we're going to look at the second part, and we're going to look at what is the way in which we learn how to classify different psychological disorders and the strategy or the method by which it's used to classification. And then we'll look at treatment just in a general sense, and we'll apply some of these treatment mechanisms to the different psychological disorders when we get them. All right, so let's begin with assessment. This is part 1 of abnormal psychology, and this is week 2.
Now, as you can remember from week 1, we looked at what is abnormal, what is, normal, and we found that can be sometimes difficult to determine between either people or circumstances, or even for that matter, context or culture. And when you look at all the different kinds of psychological disorders that there are, you can only imagine how difficult it would be to determine what behaviors meet a criteria for a psychological disorder. For example, one psychiatrist's definition of psychological impairment, one of the 3 criteria defining psychological disorder, might be very different than another man's another man or another psychiatrist's perspective. In order to sort of standardize the diagnosis process, the American Psychological Association, yes, that is the fine folks who brought you the APA formatting. That's the APA, American Psychological Association, has created a manual of mental disorders, and its current edition is the DSM-5. And it's been going on for quite some time, over 100 years, well, almost 100 years. And we're going to look at a variety of methods of assessments in this particular part of Chapter 2 that clinicians use to arrive at a diagnosis. The assessment will classify, they'll gather information regarding personality and cognition, and all information gathered is going to help make a recommendation for best treatment. Assessment methods must be reliable and they must be valid. Now, to help understand what that is, validity, this is the extent to which a study or a research instrument accurately measures what it's supposed to measure. Now, by contrast, reliability, this is the extent to which the study or the research instrument yields consistent results. So take, for example, you have some weigh scales, and you jump on your weigh scales, and you do this every day, and you eat exactly the same, and you expect your weight to be exactly the same. Well, if your weigh scales are valid, the weigh scales will measure weight, not intelligence, not creativity, not communication skills, so that when you jump on the weigh scale, because it weighs weight, it makes weigh scales valid as a weigh scale. But if you jumped on your weigh scale and it said that your IQ score is, or your vocabulary is, well, then it wouldn't be a very valid weigh scale because it wouldn't have measured what it's supposed to measure. Then if you look at reliability, and if you stepped on your weigh scale and it said whatever your weight was, 123 pounds, and then you jumped off it, and then you jumped back on and it said 383 pounds, and then you jumped off it and you got back on and it said 27 pounds, well, this wouldn't be really very reliable because the weigh scale measures weight accurately every time. A good one that's reliable will do that. And so all psychological assessments have to be able to measure psychological disorders. So they have to be valid. So that has to be looked at through hundreds and hundreds of people in case studies. And it has to be reliable. It has to be that what they're testing is psychological disorders. And so what we're going to do is look at a series of methods of assessment. And we're going to begin with the first basic used one. We'll start with the interview. Now, with an interview, it can go from standardized or structured interview. It follows a very specific regimen of questions asked in a particular manner, and that's what makes it standardized. Or it goes into a semi-structured, and a semi-structured interview has a wee bit of the standardized to it. It has a guideline of what you're supposed to do, but you have your own piece that you can introduce, the way that you want to, frame the question, or when do you want to introduce it. And then there's the unstructured, where really there isn't any structure to it. It's very much free flow, and the clinician would make some decisions based on how the interview goes as to what they would say and what kind of questions they would ask. Now, it's the most widely used assessment. The clinical interview involves the use of a set of questions designed to elicit relevant information from people seeking treatment. Now, clinicians generally use a structured interview for the most part, which consists of fairly standard series of questions to gather a wide range of information. You can look at some of this stuff when you come into page 42. You can sort of see what kind of topics that the interviewers will most often use. Now, often these are face-to-face settings, allowing the client to describe their presenting complaints in their own words. Secondly, the clinician may observe a variety of nonverbal behaviors in the way that the person's responding to questions or offering information, which also provide clues as to the client's personality and or some of the problems they might be experiencing. And third, the interviewer may orient the interview to the person rather than vice versa. At the same time, the major disadvantage of an interview is that the data may be distorted by the particular questions asked and the way that the interviewer's personal or cultural biases. Now, to fall back a little bit to, the questions being asked can influence what kind of information you get. There's two kinds of questions to ask, and one of them is called open questions, and this is where you ask who, what, where, when, why, and how kind of questions, where the answers aren't going to be just yes and no. What's your favorite color? When you feel pain, where do you feel the pain, and how would you describe it? These are open questions that allow the person to say more in their own words about the experience, which gives the interviewer, a lot more information than, are you in pain? Yes or no. Well, it doesn't tell me the quality of the pain, the intensity of the pain, or where the pain is, how long the pain lasts. It's not a very useful question. So closed questions are not as good as open questions in an interview. Now, we don't also, our methods of assessment include doing psychological tests of intelligence as well as personality. And we're going to start with what is intelligence. Now, intelligence and personality tests are structured and standardized. Standardized just means that they've been tested over a long period of time, and they are both reliable and they are valid. So they've been tested over a large number of people, and they create these norms or standard sort of responses that are categorized to sort of say, when people respond this way, they get this kind of score, and when they respond that way, they get that kind of a score. Now, measuring relatively stable traits of intelligence or, in case, personality, that must be reliable and valid. These tests can provide some insights as to what is normal and abnormal. Now, intelligence tests, they help clarify issues about abnormal behavior. Tests of intelligence, like the Stanford Binet, keep IQ scores. And the IQ score, the IQ, or intelligence quotient, is basically your mental age, that's the MA, divided by your chronological age. So the mental age is the age that you would gain based on the score that you received in the test. The chronological age would be the age that you are in the number of years times 100, and that would give you your IQ score. Now, the Stanford Binet uses the IQ score for intelligence, while the Wechsler, it uses scales. So instead of just doing one measure for intelligence like the Stanford Binet, the Wechsler uses various assessments, different aspects of intelligence, which bring about different or multiple scores. And both are used for various purposes in clinical assessments, including determining evidence of intellectual delays or cognitive impairment, that if a person could have codependent, that is, if you're have a mental delay or have a cognitive impairment, it might mean that you don't have a psychological disorder because of the impairment. Assessing strengths and weaknesses is helpful through intelligence test, and intelligence is expressed in a form of an IQ score. Now what you're seeing here is a bell curve, if you will, and it will tell you where exactly the majority of people fall on the test. This is what makes it standardized, is what makes it valid. And where on the extremes people will have a very high intelligence or very low intelligence. Now if we look at personality tests that are done, there's two types of formal tests to assess personality. One is the self-report. Now, like the Minnesota Multiphasic Personality Inventory, that's the MMPI, these are used, they use structured items to measure a variety of personality traits, such as anxiety, depression, masculinity, femininity. These tests are considered objective in a sense that they make use of limited range of possible responses to an item and an empirical or objective method of test construction. Now, empirical just really means it's clear, it's concise, there's not a lot of, does it mean this, does it mean that? They're very precise test construction. They test it over and over and over time so that when people fill them out and do these self-reports, the results can be determined to be relatively stable and based on a lot of results that they can compare against. Now the projective personality tests, these are such as the Rorschach inkblot test or the thematic appreciation test, the TAT, where you ask subjects to interpret an ambiguous stimuli, a picture, a graphic, some sort of a stimulus, in the belief that their answers may shed light on the unconscious processes. Now remember, when you look at projective is we have a tendency to project our own objectives, our own needs, our own desires onto the presented stimuli, and that's why this can be a useful test. There are still concerns persist about the validity of these tests, however. Here's an image. Now, if I ask you to write a paragraph or so in response to the following questions, I might say, so what are the people in this picture doing? What are they saying to one another? How do you think this situation is going to turn out? And so you give you a little while, and if you were to write out a paragraph or so, you usually find that the responses vary considerably. So if we were to compare a bunch of you to see what each of you wrote, we probably would find that nobody wrote the same thing. And this is illustrating how each of us tends to project our own motives, our own feelings, into the figures shown. You might point out that this is this is not uncommon that this happens. It's just that we tend to project, and that's one of the values or the benefits of the projection tests. Now, if we move to another type of assessment, the neuropsychological assessment, the Luria, Nebraska test, uses methods of neuropsychological assessments to help determine organic base for impaired behavior and psychological functioning. Now, the MRI, or magnetic resonance imaging machine, or the CT, computerized tomography, can determine both if the brain is damaged and where it is. But the Luria Nebraska battery test is based on Alexander Luria's work, is a sophisticated battery of tests measuring various perceptual, intellectual, motor skills, and performance. They're testing for the brain's function or the brain's malfunction without any surgery. Now, a pretty common area of which to explore are behavioral assessments. These are tests response are taken as samples of behavior rather than as signs of underlying traits or dispositions. The behavioral examiner may conduct a functional assessment which relates to problem behavior to its antecedent and consequence. So you'd see in a functional assessment the A, the B, and the C. This would be the A, B, C of a functional analysis. Antecedent, behavior, consequence. This method of behavioral assessment includes a behavioral interviewing, some self-monitoring or analog or contrived measures, direct observation, and behavioral rating. So when we're looking at it from this perspective, the functional analysis, the antecedent would be any of the sort of situational examples that could play. Let's say I told you you're going to stand in front of 1,000 people to do a presentation. And as you approach the experience, you get all nervous and you run out of the room and throw up. So the antecedent would have been, this potential to speak in front of 1,000 people. The behavior was the anxiety that you experienced and the behavior that you had, what was seen and heard while you probably were getting fidgety. You might have been getting your body temperature might have started to increase. You may have began to sweat and you threw up. The consequence was you didn't do the speech and you had to clean up a mess. So this is often, these functional analysis are often done through direct observation or through behavioral interviews. Self-monitoring is another form of behavioral assessment. It's techniques where you monitor or you keep an eye on your own behavior. It's like a diary. It can be very accurate of what happens, when it happens, under what circumstances it happens. But with self-monitoring, in fact, with most behavioral assessments, there's a need for a baseline. This is to say, what was the level of behavior before treatment, so that when we do involve treatment, we can compare after treatment and before treatment and see if there was an improvement and see if there was an eradication of whatever that problem was. Now, another alternative is analog measures, and this would be inclusive of something like role play. This is where the client can practice a strategy. Some phobias use stages or levels of approaching that which fears them. And then lastly, we can look at behavioral rating scales. These are checklists providing data about frequency, intensity, and range of problem behavior. So there's a variety of things that can be done in a way of gaining assessment information about a person's individual experience and what might be psychological disorder and what might be behavior, what might be biologically based, or now cognitive assessments focus on the measurement of thoughts, beliefs, and attitudes in order to help identify distorted thinking patterns, put people at higher risk for developing emotional problems, and they identify or they aim to get rid of or replace the distorted self-defeating thinking and replace it with more positive thinking. This is a process of talk therapy. It's a process of practice. Specific methods of assessment include the use of thought records or diaries and the use of rating scales such as the automatic thought questionnaire. And so there's a variety of ways in which cognitive processes are used, and these are altering your thinking, if you will, to separate the difference of being depressed or being sad can be the difference between how you talk to yourself, your self-defeating thinking, and altering that thinking into more self-enhancing rational thought. That's not a disorder. That's just changing a point of view, changing your perspective, which is healthier. And so it's discerning the difference between what is a psychological disorder and what is something we can alter more easily without any other treatment than something as simple, if you will, as changing our thinking. Now, another measure is the physiological measure. Now, some of this you will be familiar with. You've probably heard of the galvanized skin response. These measure the heart rate, blood pressure, and look for changes when someone's reporting or answering questions. You can also be looking at the EEG, which is looking at measuring brain waves. And so you get a picture over time, the clinicians do, of what do normal brain waves look like. And when someone with some impairments or dysfunction, their brain waves may not be what is considered in the normal range, and this is one way to determine that. Alternatively, there's the EMG, which measures muscle tension. And again, this is all about trying to determine range of normal and what falls outside of that. Now there's a lot of ways of measuring the physiological, and if you turn to page 57 and 58, you'll see in table 2.4 the variety of brain imaging techniques, CAT scans, PET scans, MRI, fMRI, beam, and MEG, probing the inner workings of the brain structures of the brain. And it's quite remarkable what's starting to happen and how we're able to see what's going on inside the brain. Okay, well, this is finishing up assessment. Now, what we'll be doing next is jumping into doing categorization and treatment. Carry on the good fight, and we'll see you in part 2. Bye now.